Yes, we've got another poster gem for you. So can I introduce to you Ilaria Barchetta from Rome. Ilaria, tell us about your poster.
My poster is about a new biomarker of non-alcoholic fatty liver disease in obesity and type 2 diabetes. We study this condition because it's an important complication of obesity, because non-alcoholic fatty liver disease is associated with an increased risk of cardiovascular disease and mortality in obesity and type 2 diabetes, and there is no treatment yet. So we have investigated the role of vasopressin, that is an hormone normally known for the regulation on the fluid balance into the body, because it's secreted in response to low blood pressure, but it has been shown that it's associated also with fat accumulation into the liver in rats, and its concentration are associated with an increased mortality and risk of complication in type 2 diabetes in previous epidemiological studies. Actually, the association with non-alcoholic fatty liver disease and this hormone was not explored before, so we tested in 60 obese patients undergoing bariatric surgery for clinical reason the concentration of copeptin, which is the stable surrogate of vasopressin, which can be easily measured in the plasma. And we observed that there was an important association between a higher level of this copeptin hormone and the presence of steatohepatitis and non-alcoholic fatty liver disease at the liver biopsy of this patient. And this association was totally independent from confounders and from the presence of obesity per se. So we could speculate that there can be a role for this hormone in the pathogenesis of non-alcoholic fatty liver disease. And since this hormone secretion could be modulated by increasing water intake, it could also be a new target for new treatment of this disease in course of obesity and type 2 diabetes.
So that's really interesting, and yet another hormone in that whole orchestra of hormones that are involved in diabetes.
Yes.
And this copeptin, it's readily measured in blood?
Yes, it could be easily measured in the blood with some assays that are performed in now, of course, just for clinical reason in some disease connected with endocrine diseases related to the body fluid and fluid intake balance, but could also be used actually for other reasons, like the metabolic screening in patients with obesity and type 2 diabetes.
So Ilaria, what's next?
The next will be maybe confirm it in a second court, and then maybe a trial for testing the possibility to modulate this hormone, and then the result on the liver histology.
So will we be expecting you back next year for another poster?
I wish so.
Okay, we very much hope, Ilaria, that we'll see you next year with a bit more about that copeptin. Thank you very much for telling us about it.
You're welcome.
Thank you. Wasn't that interesting?
Thank you.